Okay, note cards. Audience, thank you for coming to hear me speak. So in 2005, there was a hearing of the U.S. Senate Special Committee on Aging, and it was identified that the previous year, in 2004, $300 billion were spent on Medicare. The largest portion of this went to preventable chronic health conditions like diabetes and emphysema. It was noted the nation's success in preventing these diseases would directly affect our ability to control Medicare costs of the future. It was also noted that this would not just be a financial problem on a federal level, but also on individual families. So many of you have health insurance and primary care physicians and believe that their use is unnecessary unless you're having a complication. That is called diagnostic care. My name is Elizabeth Churchwell, and I've been in and around healthcare for the last 10 years, and I've cared for many individuals that have chronic health conditions. And they often tell me if there was a way they could have prevented this disease, whatever condition they were living with, they would have. So the push towards prevention is such a big deal now. So prevention will positively impact your health greater than diagnostic care will. One of the ways that we use prevention is by identifying risk factors. What are your risk factors for developing a chronic health condition? When you go to your annual health meetings with your physician, you will go through a screening. Your doctor will gather information on your health status, like giving your blood work to see what your cholesterol level is. They'll also do body measurements, check your weight, make sure that you're at a good weight for your age and height. And they'll check your vital signs. They'll also make sure that your blood pressure is within a normal range. The other way of identifying risk factors is looking at your lifestyle habits. The doctor will want to gather information on, they'll ask you whether or not you smoke, what's your diet and activity level like. And the third thing that they'll do is they'll want information on your family history to see if you are at risk for, if things like cancer or diabetes could be passed down to you. So whether risk factors are identified, you and your doctor should work together to create a health plan that can either maintain your health or improve your health and prevent health complications. Prevention is key, and there are many ways to do this. Counseling is often offered through your insurance and out in the community, and they can work with you to create a diet plan and an exercise plan to improve your health. According to Dr. Warburton of Cardiovascular Physiology and Rehab Laboratories, there's overwhelming evidence that supports that proper diet and exercise can prevent a chronic health condition. Dr. Pan created a study that was published in the diabetes journals that tells us that diet and exercise can significantly reduce the occurrence of diabetes, type 2 diabetes, in individuals that are diagnosed with pre-diabetes. The other thing you can do is make sure that you are getting vaccinated routinely. This is a recommendation by the CDC as of this year. This is to prevent things like the flu, measles, and chickenpox, and their prevention in the community. The other thing that you would want to look at is your health. The other thing that you could do is health promotion programs that are available in the community, and they can assist you with lifestyle changes. The CDC this year tells us that smoking increases your risk of lung cancer, stroke, and COPD. Excessive alcohol intake can cause liver failure, hypertension, and diabetes. And the National Institute of Drug Abuse Disorder tells us that the abuse of drugs can have an effect on multiple body systems depending on the drug being abused. So now you know the health benefits of prevention, but what about the money? So preventing severe and chronic illnesses can actually save you money. So the Affordable Care Act has made it possible, or has made it so that preventive care is free of out-of-pocket costs. Chronic health conditions come with exuberant costs, hospitalizations, medication costs, and sometimes surgery. Major surgeries could be needed. Most insurance plans will have high co-pays and high deductibles to meet if you have to go to the emergency room. So it's best to keep yourself healthy, focus on prevention, and avoid going to the ER as much as you can. And the other issue with chronic health conditions, you tend to miss a lot of work. So the pay time off that you have built up for a vacation will end up going towards your illness because you need to call out so much. So as you can see, there are many resources available for preventing serious health complications. Whether you are old or young, prevention will improve your quality of life and increase your life expectancy. It is time the outdated belief only seeing the doctor when you need to be stamped out. The proof found in identifying risk factors, preventing chronic complications, and saving money should gain your confidence over relying on diagnostic care. So, and the other thing is prevention empowers you to understand what your health situation is and can help guide you in developing a plan with your physician that can help benefit you in the future. Thank you all for coming to hear me speak. And remember, let healthcare work for you, not the other way around.